technology, not always a friend. If we used Zoom and we know things fail, we know how that goes. So if you're out there tonight, I'd like to know you're there. Let me know your name, or just kind of give me that Facebook or YouTube wave and let me know you're out there. But you're here for Facebook Live. I'm Keith of Keith RN, and it is my pleasure to share practical strategies that really my passion as an educator is, as a nurse who is current in practice, as well as a nurse educator, to bring practice into our practice-based profession. And so I'm excited to share some practical strategies that are going to help educators bring practice into the classroom, whether it be the traditional or online setting. And we're going to be talking tonight about helping our students to come to clinical prepared, or to classroom prepared. Now, I've been doing this for the last several weeks. It's been a couple of weeks. I just want to let you know that I've got about 2 weeks left in my PhD program. So that is a big thumbs up. I feel like I can breathe again. For those of you who have been down that path, you know what that feels like. And I'm really excited. I'm feeling a weight off of my shoulders. And I'm really, really excited just to kind of get back in front of the Facebook and share some strategies with you tonight. But in the past, we've talked about decreasing our content load so our students acquire that deep knowledge of most important, that our classrooms need to be an active learning laboratory of really bringing clinical realities into our classroom. That's educational best practice from Pat Benner and her co-authors in the Carnegie Foundation back in 2010. And so what I'm going to be doing tonight is just helping us bring that, helping our students be prepared so that they are ready to come and engage in the content. Because now as educators, if we've done our part, we've talked about how do we take 50, 60 slides, cut it down to 20 or less. So we're teaching for no more than 20 to 25 minutes tops if we're going to do a scrambled classroom. That's our goal. So now that we have them on our classroom, our goal is not to passively spoon-fed them, but to get them to come to the class prepared. That's what we're going to be talking about, and excited to share this information with you. And so on my Facebook page, Keith RN, Think Like a Nurse, if you've missed some of that prior content, you can just simply go to the video link on the far left vertical column, click it, and you can see what you missed. There's about 30 minutes of content, 15 minutes of questions. I encourage you to take a look at that, and you'll really, really find that helpful. So when we look at today's topic, I'm going to be looking at my chat right now because I have a really, really important question. How many of you expect your students to come to class prepared? That you provide an activity, an assignment, that there's a bar that you've raised that says if you're coming to class, you need to come prepared to learn. How many of us are doing that? And it's okay if you're not, because I think the culture that I've seen is I've traveled across the country in nursing, at nurse conferences and workshops. I find that most programs and most faculty struggle with this. And so I'm going to look at my chat box, and I want to kind of see where we're at and where we're kind of maybe just as we look at that. Laurel, you're the first one who responded. I expect them to, but they don't. Now, Laurel, I have a question for you. Do you have any consequences for your students if they don't come to class prepared? I'll be talking in a little bit, but I've learned that one thing in my journey that students will do, you can get them to jump through almost any hoop for a point or so. And so I'm going to be talking about some ways that we can kind of do that. But Susan says, this is my goal this year. Excellent, excellent. And it's a great goal, Susan. I want to encourage you to do that. Mary says expected, but doesn't always happen. And, Susan says hard to know how much prep time to give. And, Susan, I'm going to share a couple of simple tools that you can use in your classroom. And this can be used either in the traditional classroom or online. So the bottom line is that this principle of, in essence, having a ticket to class is something that you can all do. And so, yes, Mary says we made a ticket to class for 1.5% of their overall grade. Mary, I'd like you to type in, I'm going to share my strategies, but this chat lives forever on Facebook with each video. So, Mary, I want to encourage you to, in essence, put a brief paragraph of what you're doing so other educators can learn. Marcella says she's going to implement this. I try to have consequences, but sometimes their prep is their ticket to attend. And that's what I'm talking about, is just a simple prep activity, whether they be quizzes, a portion of a case study, or etc. So you're all with me, and they're all tracking. And as I look at nursing education as a newer educator, what I noticed is this: in our syllabi and in our expectations, we expect our students to come to clinical prepared. That in essence, if you don't have your stethoscope, if you don't have your name badge, if you didn't bring your paperwork, but you showed up, what would most of us as clinical educators do? And I want you to put that in the chat. I think that if your students did not come to clinical prepared, you have language in your syllabi that would say, goodbye. You're not prepared to learn and to take care of patients today. You're going home, and there'll be consequences for that, whether it be a makeup activity, a loss of points. But in education, I know we have a very high bar of clinical preparation, but a relatively low bar. And I think it's too low for classroom preparation. And I think that there's a saying that I think that's really important for us to grasp as nurse educators. And if you've got your notebook, if you're at home and you're taking notes, please write this down. No student will rise to low expectations. I want to say it again. No student will rise to low expectations. Your students will go no higher than what you expect of them. So the question is, we have that high bar in clinical, and 99% of the time, our students meet that bar. But when it comes to classroom, if we're not expecting it, and even if we do expect it, but there's no consequences, students learn really quickly, kind of like children in parenting, that if you don't follow through, you don't really mean what you say, with a consequence or something that will give them an incentive to do so. And so I want you to think about how many, I think many of us can raise that bar. And that's kind of one of the things I want to share today, is how we can practically do that. But, it's important that as educators, we understand the why, of everything that we do. We just have to be like our students in a nursing practice. Why do we do certain things? So the question is, why do we want to raise the bar of classroom preparation? Because once we as educators understand, I think, very clearly the why, we may know it in an ambiguous way, we just know it's the right thing to do, but there's a really good reason why, and I'm going to share it with you briefly. When you understand this essential formula for practice and nursing judgment, clinical judgment, that critical thinking plus clinical reasoning equals a outcome of a correct clinical judgment. Now, when you understand that critical thinking is, in essence, understanding essential content. Now, there's many cognitive skills of critical thinking. I'm using a very simple, concise definition from Potter and Perry, but it's the ability of the nurse, critical thinking, to understand and to act on what you know. And then the reasoning of clinical reasoning takes place at the bedside, where you reason with your understanding, you reason with your knowledge that's applied to the bedside of patient care, and you make them the decisions and the outcome of a clinical judgment. Clinical reasoning takes place in clinical. Critical thinking and understanding and using knowledge takes place in the classroom. And when our students don't come to the classroom prepared and have done their engagement of the content, doing their part to learn, because it's not a 90-10 equation, it's 50-50. We teach and we do the best we can, our students learn. But the classroom, in essence, is a laboratory to develop the critical thinking. And what's very sobering, that if our students miss one part of the equation, they're unable to critically think by understanding essential content and using it, or they are unable to reason with it at the bedside, the outcome of a clinical judgment is not made. It's going to be lacking. It's impossible. You have to have both in order to make the judgment. So therefore, critical thinking takes place in the classroom. And that's really the paradigm shift and the piece I want you all to understand why we need to do that and why it's important for practice. Now, how many of you know that in nursing education, change is hard? Changing culture is hard. And in my doctoral program and some of my leadership course, we had Timothy Porter O'Grady's textbook on quantum leadership. But he makes it very clear that change cannot be avoided, and it's an opportunity to innovate. But what I want you to recognize is that progress is optional. And as we have been forced to change in nursing education, yes, we've changed, and some of us are dragging our feet, and it's been very painful and difficult transitioning to online. But in essence, have we improved how we are teaching nursing? Have we innovated? Change is not just happening when we have a coronavirus pandemic. It's inevitable in our profession as well as academia. We need to embrace it and recognize and use it for good. But we need to recognize that the ability to make good of change, to make progress in how we change and how to strengthen is optional. And I was introduced in my doctoral studies to a very simple theory called Lewin's change theory. It's Lewins. And I want you to Google that after I'm done tonight, or just make a note of it and research it, because I'm going to apply it to our classroom and to our academic culture. Lewin's change theory is very simple. There are three distinct stages that an organization must do to implement needed change. And if these stages are not implemented well, lasting change of any kind that is needed is not going to happen. The very first step of Lewin's change that lays the foundation for changing classroom culture. That's where I'm going with this, because you can't just flip it. You just can't flip a switch and all of a sudden do things differently to make it last and to be effective. The very first step, you have to involve others. These are all three I words. So if you're taking notes, I hope you write them down. Involve others and explain why things need to change. When you look at, when you get, and this is where as a department, we have to have a culture where everybody ideally is on the same page with classroom preparation, which is our focus for tonight. That, we can't just be that outlier or it's not going to last. We have to have this as a departmental kind of cultural shift and explaining the why that critical thinking takes place in the classroom, and that we need to do our part, that our students are doing their part to do that, and to, in essence, we need to explain the why, the need for transformation and change, and advocate for it. In essence, we need to kind of take a frozen culture that's like an ice cube, and we need to melt it and liquefy it so then it can be refrozen in something better and something different. Then we need to implement the change. So explain the why to our students. We need faculty buy-in. We need student buy-in. But in essence, we can lead the dance as faculty. We need to first be on the same page as our department. The students will follow where we lead them, do they not? Second I, implement. Implement the change and have a clear plan and a strategy to implement, and a consistent framework, whether it be quizzes, handouts, portion of a case study. I'm going to be sharing some very easy ways that you can change culture in your program to improve the classroom participation and preparation. So we involve, we implement, and then the final step is institutionalize the change. In essence, we need to now refreeze it. And in essence, what that involves is that in order to have lasting change, it needs to be made policy. And in academia, what is the one contract with our students that puts it in writing what your expectations are and what you're holding your students to? Well, last time I checked, it's the syllabi. And therefore, this is why this is very timely. If we haven't made our syllabi public yet for the fall, this is an opportunity for your department to have some needed dialogue and discussion and talk about it so that we can institutionalize a culture that expects our students to come to class prepared and to have simple language to do that. And so when we look at that as it relates to classroom learning, here's just kind of a simple way that we can begin to move that chain forward. In orientation, the first day of our new program, we communicate to our students that, you know what, teaching and learning is a 50-50. It's not basically we spoon feed you and we give you all the information like you had it in high school. For most of them, you're going to have to do your part. We'll do our part. It's a collaboration. It's a partnership. Not so much like you're paying me to learn, give me the information, which is where way too many of our students are coming from. So we have to communicate culture from the beginning so our students don't know anything differently. So it's not just like, oh, it's only one faculty in second semester and another one in fourth semester who does this. No, this needs to be institutionalized throughout. And so for our students, we need to get the buy-in. So we have to communicate the why. We want to get them on our side to see why we want to make them work harder, which is smarter in nursing education. We communicate that classroom is no different than clinical. Just as we expect you to come to clinical prepared, classroom prepares you for the critical thinking, the understanding of what is most important to practice. And I'm going to do my best to do that as faculty, but you have to do your part to come to this classroom prepared, just like clinical. And you can use that same approach with active learning, because as you know, and we've talked about in other sessions, when it comes to case studies and active learning that makes them think, makes them work, makes those wheels spin. Some of them don't want it to spin so quickly, want to work so hard. They resist it. And again, the same rationale works for active learning. So you're communicating kind of like, this is the culture of our program. You come to class prepared, and learning is going to be active from day one. Then we implement. That's the second step of Lewin's. We then do it with the ticket to class, and then we get faculty buy-in. And so if I'm going to say, if there's any way that, some of the faculty who posted earlier about, well, I expect it, but they don't always do it, is it in your syllabus? That, let's just put, I just kind of came up with a very simple statement, and I encourage you to write this down. A loss of 1 point will occur when pre-class assignment is not submitted prior or upon arrival to class. That's it. You know what? They don't get anything extra for doing what they should. We're not going to give bonus points or bonus points on a quiz, in my estimation. I think that's, if they're doing what's expected, we don't give them extra. But when they don't do what's expected, we take away a point. And you know what? How many of you know, if your students are, I'm sure just like mine here in Minnesota, they will do just about anything for an extra point, especially if they're at that 78% or 80% range. It's valuable. And you know what? We're not there to punish students, but we're there to hold them accountable. And this is a practical way to do that. And so what I want to share with you are a couple of practical ways that we can institute a ticket to class. And so I'm going to see if my screen will share here. And I'm going to just kind of go here. And you know what? My screen does not want to share tonight. And that's kind of like, that's technology, unfortunately. We'll try one more time. Nope, it's not going to do it. Well, that's okay, because I came prepared. What I want you to do is this. There's two things, that I'm going to start with the first thing. I was hoping to share my screen, but this is very simple. I don't need to do that. A couple of sessions ago, I did a skinny reasoning case study. It's a small, concise level that I developed that integrates Tanner's model of clinical judgment And it has two parts. The first part is only 2 pages, where you have the scenario. This was on a UTI, so if you missed the 2 sessions ago, go. You can access that and see what I'm talking about with this. Or if you have any of my skinny reasoning case studies, you've got it in front of you. But it's 4 pages, and the first 2 pages are the first 2 steps of Tanner. What do you notice? What is your interpretation or the relevance of this data as it relates to the scenario, the vital signs, the assessment, and the lab values? That's only 2 pages. It's a PDF document. You post it ahead of time. And I would say at least a week. And if you're teaching on XYZ content, whether it be a conceptual program or traditional, whatever your exemplar is, and if you want to use one of my skinny reasoning case studies, you can do so. And those first 2 pages are the student's preparation. They come to your classroom that they have read the textbook because they're going to have to read. It's not optional. And that's where we need to make it the need to read pages, not just the whole chapter. But then the second 2 pages is responding of Tanner's model of clinical judgment, step 3. And that's in essence saying, what's the problem? What's the physiology of the problem? What is the medical plan of care with the orders that the primary care provider orders? What's the nursing priority plan of care? What's the educational priority? And then talking about caring and holistic care. About 5 questions. And those you can kind of synthesize then as within that 20 to 30 minutes of your second half of class every hour, you can then focus on that second half and have them do small group work or whatever. But that first portion of the case study is their ticket to class. There's also another way to do this. And I have on KeithRN.com, I have a free skinny reasoning case study I want you to have. If you go to KeithRN.com, at the top of that page of my website, you'll see download free skinny reasoning COVID-19. It's a wonderful oxygenation exemplar or relevant to COVID-19, which is unfortunately we're still experiencing. But I also have a second ticket that you can access. And I was going to share my screen. Unfortunately, can't do that. But when you go to KeithRN.com on the home page and you scroll down to the bottom half, you're going to see a salmon button that says free resources. And when you click that button, this is what you're going to get. And I'm not going to be able to share my screen, unfortunately, but I will explain what that resource is. And it's called Developing Critical Thinking through Understanding Pathophysiology. It's a 1-page handout with 6 questions. And you can use this for whatever you're teaching. If you're teaching any kind of systems-based approach or anything that has a medical problem of some kind. I know it's not going to work for everything like leadership and capstone, but for the majority of content in your program, help your students go deeper with pathophysiology. This is a 1-page worksheet that they can fill out ahead of time. And so if you're teaching on heart failure or sepsis or anything that has a physiology, your students need to engage with it. Here's 6 questions. Number 1, the pathophysiology of this problem that you identify. It's in your own words. So your students, if you're teaching, for example, on COPD, pneumonia, they have to identify the pathophysiology of COPD and do it in their own words, not just copy and paste. Second question, how do you teach this problem to the patient and family? How would you bring it down a notch? You know, from the textbook knowledge, and again, you have to understand it, to now you're going to teach a patient about COPD. What are you going to say? How would you concisely simplify COPD? That's question 2. Question 3, which body system is impacted by this problem, and specifically how? How is COPD? How does it affect the lungs? What's it doing to the lungs? How does it affect, ventilation and diffusion? Go deeper with patho, because patho's the foundation of critical thinking. 4th question, what are the priority assessments related to COPD? How are you going to do a good respiratory assessment? And is there anything else you need to look at besides the lungs? How about their skin color? What about their nails? Looking for clubbing, etc. And what are expected abnormals? Because as we know, just because, when someone has a disease, their baseline is going to be affected, and helping students look for that. Fifth question, what lab values are altered with COPD? Boy, look at their basic metabolic panel. What about their CO2, which is their bicarb? If they're a CO2 retainer, is that bicarb going to be elevated? Absolutely. Understanding why, though. That's where our students need to go. And so again, how does that affect assessments is in that worksheet. And the sixth and final question, what are the medications most commonly used to manage COPD, for example? And the MEC of action in your own words. 6 simple questions, but yet these 6 questions can transform your classroom, not only by having your students come to class prepared, or using this as well in your clinical setting, where they can use this with any patient that they have to go deeper on the physiology. But in essence, they are taking accountability for their learning. And we don't have to teach them everything about pathophys. We can just highlight this worksheet and have some very salient group discussion and kind of highlight it and see how your students did. But they have to show that ticket. If you've posted this simple one-page PDF ahead of class a week, you've given them a week. This is 6 questions. This is going to take them maybe an hour. That's not too much to expect. Maybe a little bit longer, but it's worth it because this is meaningful activities that are going to prepare your students, not only for this understanding this problem, but this knowledge is going to strengthen them for practice. And so one thing I'd encourage you, if you don't know a lot about Keith RN and what I do to serve the needs of educators, I just want you to go to my website, keithrn.com. Again, I've got these free downloads I want you to take. I've got 30 case studies or so on my website that have got the skinny reasoning level, which is short and concise, as well as the unfolding reasoning that's about twice as long. That takes about 4 to 6 hours to do as a clinical replacement activity. If we're still doing online clinicals, that unfolding reasoning can serve your needs very well. But I have a better value in my membership for nurse educators, which has 110 plus topics across the curriculum, exclusive to the membership that you can't find anywhere else. And I encourage you, I've got a monthly payment plan on that. If you go to thinklikeanurse.co, I've got a plan for individual educators, but my best value is for departments. So if you're a nurse leader or you see the value of what I've developed and have used it, the departmental membership would get all your faculty access to tickets to class and skinny reasoning and other levels of cases and other resources to strengthen how nursing is taught. But, in closing, we can't do change alone. And, that's why it's my passion, to create the Facebook group, Teachers Transforming Nursing Education, that many of you are inside. But if you're not, it's a closed face group community of about 5,000, 5,100 dollars. I think it's 5,400 now, that are there to support each other, sharing resources, knowledge, strategies. If you're not inside that, please go to Facebook and just search for Teachers Transforming Nursing Education. I'd love to get you in. Just let me know you're an educator. I don't want students. And if I can't tell who you are, I'm going to decline that invitation just to protect my members that are inside. So just want you to know that's there. And if you have any questions for me that I can't answer in this chat, please email me at Keith, and that's KEITH, at keithrn.com. So I'd like to know, what did you take away from this? We fortunately covered this in 30 minutes with a 5-minute delay, so I'm glad I didn't take longer than expected. But I'd like to know, what is your takeaway and what is your next step? Because, we're on a journey of 1,000 miles as nurse educators. And, it all begins, that journey to transform how we teach begins with that first step. And so I'd like to know what you found helpful from what I shared, or anything that you could share with this community that is watching tonight. And I'm just blessed to have hundreds of additional views after this is done, because not everybody can watch this live, but the recording is there. And so if you've got something to share, these Facebook chats live forever, and I'd love to get your feedback. So I'm just going to kind of scroll to the bottom here. And And so look at some of the pieces here, and I've got some feedback already. It says, Jamie says, could you please provide the ticket to class to members of your website? And are you referring to the membership, Jamie? Because if you are, they're already there under the clinical tab on the home page. But if you need something more from me, please let me know, and I'll do that. And Laurel, you communicate that the unfolding reasoning has been amazing as a clinical replacement activity, that students have been positive. Now, how many times does that happen? Let me be honest, because I know that students are our worst critics, are they not? If they find value, you know you got something, I think, that's very strong. So thank you for sharing that, Laurel, and helping them connect the dots better than other resources. And you know what, Laurel? That's really my lens of practice. You know, what makes me unique, I think, among a lot of, as it relates to someone who serves nurse educators, I'm current in practice. And so I bring that lens of practice that really helps students see the relevance of just what, as it relates to bedside. So thank you for sharing that. And so Deb says, you've validated what I've been doing for several years. That's awesome, Deb. You know, not that I've got it all figured out, but I think that as educators who bring a practice-based perspective, and all of you I know want to do that, and some of us have been removed from practice for some time, some of us are not, but regardless, we know what nursing is. And it is a practice-based profession, so let's not lose that lens of practice regardless. And so, yeah, Kimberly says, I'm going to use and include this pathophysiology into our course. I don't know if that's a pathophys course, Kimberly, or what your plans are, but please use it. You know, I used it with my students when I was teaching as an adjunct instructor. They found the value of it very helpful. So, yes, excellent feedback. I just want to make sure I didn't miss anything here so I can kind of just keep going here. And so, yes, Ms. Celia, I love your feedback that students need to partner 50-50. I will not give points for something that they are required to do. And that's, Ms. Celia, we're on the same page. So awesome. Thank you for sharing that. I like the idea of taking away points for not submitting the prep works. And yes, Grace, you know, that's just an easy way to do this. We don't want to inflate grades. We don't want to give bonus points because we can. It's like we need to kind of recognize that this is not optional. It's kind of like showing up with your stethoscope to clinical. And if you don't have it, you lose that point. Excellent. Kimberly says, I'm going to look into Keith RN for our faculty. If you have questions, Kimberly, again, go to thinklikeanurse.co and look. If you have questions, just email me. I'll be glad to answer any questions you might have. So thanks for sharing. Marcia says, I like this idea very much, and we'll look into the membership and incorporate skinny case studies. And yeah, the skinny reasoning is really the most versatile, but even as a clinical replacement activity, it's 4 pages. It still takes students 2 to 3 hours to work through. So if you have a 2-to-1 simulation in your state, a skinny reasoning could serve your needs as a replacement activity, as well as those first couple of pages make it very easy to break it up. It's 2 parts, part 1 and part 2. So yeah, thanks for sharing. I'm just kind of got some great feedback here, so I don't want to miss anybody here. Just kind of looking at what we have here. Yes, using cases effectively, Susan. Yeah, Grace Paul, you know, Grace, I want to kind of highlight your comment. Grace said this: it would be nice to have all faculty on board, but with academic freedom has its pros and cons. And Grace, that's a deception. Because academic freedom gives no educator the freedom to disregard educational best practice. We don't allow our students to do that when it comes to clinical. And as educators who are scholars, PhDs, EDDs, DNPs, and masters prepared, we have to embrace educational best practice. And what I'm sharing with you is Pat Benner, the Carnegie Foundation, Chris Tanner. This is scholarly work I'm making practical. This is not like, oh, Keith RN is Keith RN. He's just on his own little wheel telling us how to do things. Absolutely not. My passion is to take my lens of practice, but build it on the foundation of the scholars of our profession and best practices. And that's what I'm sharing. So you know what? We don't have the freedom to disregard best practice as academians. That's kind of and I see that excuse, and I know you didn't mean anything by it, but we need to kind of call it out. We can't, let academic freedom negate educational best practices like rock, paper, scissors, and we know who wins in that. So yeah, thanks for sharing. And I would say, Susan, you're right. Case studies are great, just to need to use them more effectively. And I think that, how we use them, whether it's breaking up in small groups, my cases are open-ended. There's no multiple choice. There's no multiple selections anywhere. You either know the content, you know what's relevant and why, or you don't. And that's really like practice, because in practice, you don't have multiple choice. You either know or you recognize something that is relevant, or you fail to recognize and you fail to rescue. And those are high stakes. So let me just keep going here. Laurel, I'll bring these notes to my faculty meeting involving stakeholders. And Laurel, share the video link. There's this video, once it's produced, it has a link you can just send by email and anybody in your department can watch it. And that's true for all of you. I just want to encourage you, if you're finding value from this, please share this information with anybody who would value and benefit from it. Even if they're not necessarily on the train yet, let's help them move that along and have some great dialogue and discussion as a benefit. Grace has a question. What is your thoughts on giving a quiz in the beginning of the class for proctored points? That's another strategy, Grace. And again, I'm not opposed to that as long as those points are built into your final semester grade. They shouldn't be bonus points. They should be built in to your course, so they're not extra. That would be the caveat that I would introduce. But the point is, let's be creative. We can do a quiz one week. We can do a case study the week two. We can do the physiology worksheet or anything in between that you've used and found valuable. So let's mix it up, but let's make sure those points are built in. So that would just be my thoughts, Grace. And if you have any questions or comments, feel free to email me. It's an OB course and we touch on pathophys, but not in depth. Says Kimberly. And, Kimberly, I would say, let's go in depth. Let's help our students understand, essential OB content. If they don't understand it, they can't critically think or reason in the OB setting. So I would just encourage you to consider going deeper with that. Amy says implementing at the beginning of the course is so helpful. Thank you for that suggestion. And, Amy, so true. Let's change culture at the very beginning of our students when they come into our program. But this is where faculty need to be on the same page. And Becky talks about tickets to class are due day one, signed course contracts. I have tickets to class due each week. To beginning of class, expectation is set in the beginning. Tickets to class are calculated in overall grade. And Becky, you're doing it. So, what I'm sharing is not necessarily like I've invented anything. I think I'm advocating for something that really captures the essence of strengthening student learning. And Becky, you're doing it. And so my hat is off to you, and I commend you for really being an innovator. I would like to know how your faculty and your department are doing, if you're kind of the lone, kind of the outlier, or if this is a culture. Because at the end of the day, we want to change culture in nursing education in our departments. It can't just be one or two, even though that may be where it starts. But let's let this leaven of transformation and changing the way we teach, embracing best practices, really be an influence in our entire department. And so Kate says, yes, my students use Kate's format for their case studies, and they are doing great. Glad to hear that, Kate. And it's really my pleasure just to bring that practice-based perspective into your classroom. So thank you for sharing. Amy says this, my students appreciated the unfolding COVID-19 case. Wonderful. It helped guide them to focus and determine relevant data and its relationship to interventions. And Amy, all I've done with that case study, as well as all of the other case studies, is the same structure of taking a scenario based on the topic at hand and integrating Tanner's framework of clinical reasoning, of noticing, interpreting, responding, and evaluating, as well as additional questions that are, from my lens of practice, that kind of add to Tanner's practice-based framework of clinical judgment. And as you know, Tanner's framework is also the essence of next-gen NCLEX and the NCSBN model, which is 6 steps dovetailed directly with Tanner's 4 steps. And so just an FYI, so using case studies that integrate Tanner's, which is what mine do, can also prepare your students for next gen as well as practice when that comes. And so, Susan, I love your comment here. I want to encourage you. You're working on paring down your PowerPoints to have more time with relevant activities. And if you've got time yet before fall, if you have that luxury, keep going. You're on the right path. And your students will thank you after they graduate that you really prepared them well for practice by doing those strategies. And that's kind of where I was I wasn't a difficult instructor. I love to teach, but I raised that bar and my students thanked me afterwards. And that was really a blessing to get that feedback. So well done, Susan. Rosemary, I'll just kind of, says you've done pre-class and post-class quizzes, helped me ID any general misunderstandings. The points were calculated in a 6% category. Excellent. Also used your case studies to discuss in class. Students say this helps them pull all the information together. And yeah, thank you so much for sharing that, Rosemary. You know, it's like I get that feedback a lot from my case studies that that's the challenge. When I ask educators, what's your greatest challenge? They can't put it all together. They can't think like a nurse. Well, by taking my lens of practice and applying it to essential bread and butter scenarios that our students need to understand, I just using Tanner's framework and my own lens of practice, it helps put those pieces together for students. So thank you for that feedback. And I got Chandrika just checked in. What are ways to do concept-based teaching versus traditional lecture? And Chandrika, I wasn't necessarily talking about that tonight, but if you have questions about that, I'd be glad to email me at Keith, Keith, at keithrn.com. I'd be glad to share and to help serve your needs any way I can with that topic. And I've got one more here from Amy. She says, I really appreciated that you pointed out the NCSBN clinical judgment model into your case studies and pointed that out to students so they know how to prepare for NCLEX. And so, yes, thanks so much, Amy, for sharing that. And, really, I developed these case studies like 8 years ago, before Next Gen was even on the horizon of nursing education, but I integrated Tanner's model because I saw the value of her reasoning judgment framework as a practicing nurse and just kind of used that as my foundation. And now it's actually quite timely. So that's a real pleasure and glad that it's serving the needs of educators and really developing the judgment they require for practice. And so that's my last comment. I want to thank you all for showing up. And, in 2 weeks, I'm excited we'll be doing this in 2 more weeks. And in that session, I'm going to be sharing some takeaways from my dissertation study on unfolding on case studies that I've developed and its impact on clinical judgment and critical thinking. Primarily on critical thinking was the construct, but I got to share some background on this study and some things that I hope to publish. And so I want you to be the first in line to hear what I have to share and take it from there. But I also want to give you one more piece of information. On August 13th, I'm going to be sponsoring a 4-hour online conference that's going to be from 10 a.m. Central to 2:30 p.m. on Thursday, October 13th. And I'm excited to not just have myself, I'll be doing only just one session, but I've got other colleagues and I've got a guest that's written a textbook on online learning and instructional design, bringing in the science of learning and teaching based on the science and helping our students in developing your own case studies and messy cases based on your lens of practice. And so there's going to be some wonderful content that'll be coming up. I'll have more information in the next week or so. So that'll be posted on my Facebook. If you don't already get my updates from Keith RN, if you just go to my website, keithrn.com. You'll get, if you download any of those free resources, you'll also be signed up for my email updates. And I'll keep you in the loop with updates and information and resources that'll best serve your needs in nursing education. So I want to thank you again for coming. And what a blessing to have you all here tonight. We'll see you in 2 weeks. And blessings to you all. Have a great night. Take care.